I just wanted to bring your attention to a couple of forms that are floating around in the ED. We haven't had an opportunity to brief everybody on them, so I'm going to try and do that now. This study is pertaining to the rate of CT contrast extravasation through our ultrasound guided IVs versus our landmark placed IVs, or with the traditional technique. This form here can be found on the Sonosite S, or the iLook as some folks call it. It's in a 3-ring binder. You just take this form out on a patient that you're about to put a ultrasound guided IV in, paste a patient sticker on there, then check which IV you use, whether it's the long 18 or one of the short 18s. And then depending upon what job title you are, then slide over and put the number of attempts that you've had with ultrasound guided IVs over your career. So for some of us, that's going to be hundreds, if not thousands. Others, it's going to be 5 or 10. It is not the number of IV attempts on the individual patient. And then lastly, I want you to place a dot roughly where you place the IV. Was it below the elbow? Was it above the elbow? And do you know whether it was in the cephalic, the brachial, or the basilic? If you're not sure which vein it was, just do a good estimate. It does not have to be perfect. Don't stress out about getting the exact right vein. Once you complete this form, there is a box attached to the Sonosite S. It is a gray metal box. It says ultrasound IV study. Just place this form inside that box. And I want you to fill this form out on every single person that gets a peripheral IV under ultrasound guidance. Does not necessarily mean that they're going to get a CT, because I know a lot of times up front we don't know whether they're getting a CT or not. So just anytime you do an ultrasound guided IV, fill this form out and place it on the box that is attached to the ultrasound machine. So you don't have to go searching around the department to find a box to place this in. Again, it's attached to the machine. The second form has been distributed to all of the nursing stations around the acute care area, as well as in observation. This form is only for patients who are getting IV contrast CTs, and that could be brain angiograms, that could be pulmonary angiograms, aortic angiograms, your run-of-the-mill CT of the abdomen and pelvis with IV contrast. Any patient that's getting IV contrast, we want this form filled out. And all you do is place the patient sticker there and then mark whether the patient got an ultrasound guided IV or a landmark IV. And that's all you have to do, and then place it again in one of the gray boxes that has been distributed throughout the department. And obviously, I really, really appreciate any help that you can give. This is going to be going on for at least the next year, and as many of these studies we can get is going to help us monitor the rate of contrast extravasation.